Hello, folks. Posture check. Don't slouch and sit comfortably. Hydration check. Drink when you feel thirsty. Mental health check. Okay ka ba dyan? As we approach our second year in quarantine, what have we achieved so far? To quote a very famous singer, are we out of the woods yet? Is a very open and public checkup of our healthcare system condition in today's episode of our podcast. Kabataan, it's now time. Now, youth talk.
How do I reconcile
How do
my
we
loved
deal
one's
with
political
How do we
differences?
campaign in a
How do
pandemic?
we engage our
How do
candidates?
we
What
talk to
if
our
I don't
community?
like my elected
How do you
officials?
respond to respect my opinion?
It is now time for the voice of the youth to be heard. Now, Youth Talk.
Kabataan ang maririnig, katotohanan ang mananaig. Oras na tayo na, boto mo'y mahalaga. Kung hindi ngayon kikilos, kailan pa ba?
Good morning, everyone. Welcome to this special episode of Now Youth Talk, wherein in 5 episodes, we will talk about some of the major election issues that need to be addressed in the 2022 campaign period. I am Migo from the University of Santo Tomas, and I will be your host for today's discussion on health. Alam nyo guys, yung dahilan talaga kung bakit ko pinili i-host tong podcast na to, especially regarding health, is because ako mismo nakikita ko yung mga taon, especially our healthcare workers, on how hard they are really fighting and how hard they are trying to save our nation. Kung meron talagang bayani or if meron talagang hero na pwede nating bigyan ng medal, bawat isang healthcare worker na yun. And we can really say na hindi talaga madali yung trabaho nila, and they deserve so much more recognition, and they deserve so much more in terms of everything that they do and everything that they can get, right? So we are shuffling our usual format to give you guys a rundown of the election issues covered by our youth activation campaign, Now You Vote. By now, you know, o diba? We'll be starting with food security, followed by education, health, peace and security, then transparency and accountability. As we equip you to handle these important conversations, our call remains oh so simple and oh so important. Let's talk about issues, let's talk about platforms, and let's talk about the people. Time check naman tayo dyan. It is now time for the voice of the youth to be heard. 40 million members of the youth are now set to vote on May 9th, 2022. Whether or not you are part of this demographic, kung hindi ka man makakaboto ngayong eleksyon, this election is with no exaggeration the defining event of our generation. That's why our call for 2022 is kabataan ang maririnig, katotohanan ang mananaig. O, di ba? Change a mind today. Share this episode with your friends and family and have them take part in 2022's most important conversation. Okay, so, guys, now, health is not just the absence of sickness, guys. Hindi lang yan kapag wala kang sakit or parang hindi ka inuubo or whatsoever. That's only a part of a person's physical health. A physically healthy person is able to perform all its basic functions with ease. But is a physically healthy person holistically healthy now? We must also consider a person's mental health, of course, which constitutes a person's ability to think, feel, and cope with daily life. It has to do with our disposition and emotions. Tied to all of this is, of course, our social health as well, which constitutes a person's interactions with the people and social forces in their environment. Social health is determined by the meaningful connections you make sa mga friends natin, family natin, relatives, and whoever na malapit sa puso natin. Sabi nga ng isang kanta, ang lahat ng bagay ay pagkaugnay. When the population is unhealthy, so is the nation and vice versa. When we are led by competent administrators, we get to live in a nation that's conducive for our health. As we take a look at ourselves, tanungin naman natin yung mga sarili natin. What led you to this state of health? Beside your personal upbringing and upkeep, what kind of environment do you live in?
COVID-19 testing center. Presidential spokesperson Harry Roque claims thousands of other testing labs are already operating across the country. The RITM's budget could be slashed by as much as 170 million pesos for 2022.
Dahil 80% sa kanila, hindi pa umano nakatatanggap ng COVID-19 benefits na ipinangako ng pamahalaan. Ang problema, wala na namang pondong inilaan sa mga benepisyo at mababawasan pa ang budget ng mga ospital base sa 2022 National Expenditure Program ng Department of Budget and Management. Pinakamatinding tatamaan ng Philippine Children's Medical Center na may 891 million budget cut. Ang Philippine General Hospital na matatapyasan ng 130 million pesos at Lung Center na may 100 milyong kaltas.
Having established that our overall health is influenced by a socio-economic and political factors, we then take a look at the health of our healthcare system. Is it in a healthy condition? Does the government spend enough for our health? Tignan naman natin what our future government leaders have to address in their terms of service. The country right now has a high maternal and newborn mortality rate and a high fertility rate. Maraming Pilipino face diseases such as tuberculosis, dengue, malaria, and HIV or AIDS. These diseases pair with protein energy malnutrition and micronutrient deficiencies that are becoming increasingly common. The population is affected by a high prevalence of obesity along with heart disease. The World Health Organization describes the Philippine healthcare as fragmented. The government spends little money on the program, which, alam niyo yun, causes high out-of-pocket spending and further widens the gap between rich and poor. Filipino families naman who can afford private healthcare facilities usually choose these as their primary option, of course. The public facilities tend to be in rural areas that are more rundown. These facilities have less medical staff and inferior supplies. And guys, only 30% of health professionals employed by the government address the health needs of the majority. Healthcare in the Philippines suffers because the remaining 70% of health professionals work in the more expensive privately run sectors.
With the story.
Overburdened and understaffed. The healthcare system is on the brink of collapse, warn medical workers in the Philippines. Doctors and nurses have been working around the clock since the COVID-19 pandemic struck early this year, and they're crying out for help. Dr. Edmond Villaraman has been working 7 days a week for months now, juggling back-to-back surgeries and procedures. The past few weeks have been brutal as infections continue to climb. COVID-19 patients have been arriving in droves, and most of them are in a bad state.
Most of these patients are connected to a ventilator, connected to a cardiac monitor, which we don't have anymore. And they keep on coming at the emergency room.
Most public and private hospitals in Manila are now at full capacity, and many healthcare workers lament shortages in personal protective equipment.
We need it now.
Medical groups have been sound.
Kanya-kanyang oxygen tank ang ikinabit sa mga nakapilang sasakyan sa labas ng isang pribadong ospital sa Cebu City. Laman ng mga sasakyan ng mga pasyenteng naghihintay makapasok sa ospital. Ayon kay Cebu City Councilor Dave Tumulak, Biyernes pa raw nakapila ang mga sasakyan.
33 patients waiting makapasok dito sa loob ng hospital na ito. So they are all suspected COVID. Hindi na sila gusto na paulit-ulit na paikot-ikot. So dito na lang sa hospital na ito. At saka tinitingnan naman sila ng mga nurses at doktor.
Ilan daw sa mga pasyente, sinubukan ng pumunta sa mga ospital sa mga karatig lungsod, pero punuan na rin daw.
It's been all over the news, even before the pandemic. A long line accumulates at the Philippine General Hospital's triage every morning, with hundreds of Filipinos seeking assistance. This has been a situation in our hospitals since time immemorial, guys. It is not a small number of people who need healthcare. It is everyone, every Filipino, everybody residing in the Philippines who needs healthcare. Let's now take a look at the people who keep our hospitals running. Whether public man or private, behind the healthcare system is the large workforce that is required to keep it functional. How does our government treat its healthcare workers? Nurse-to-patient ratios are at a low at 12.6 nurses for a staggering 10,000 people. Sa rural areas naman, 4.2 nurses may service a population of 10,000 people. The scale is definitely jarring, but are they sufficiently paid for their service? The salary standardization law was signed by President Rodrigo Duterte, where there would be an increase in the take-home pay of nurses starting January 1, 2020. But the increase of around 1,500 pesos is relatively insignificant for someone raising and supporting a family. Guys, hindi sapat ang 1,500 pesos na dagdag ng kita para makabuhay ng pamilya.
Agad kami.
At sa gitna ng isyu ng maliit na sweldo at kakulangan ng benepisyo, gusto man daw ni Mark na magsilbi sa ating bayan. Hindi raw maiwasang pumasok sa kanyang isipan na magtrabaho na lang abroad.
Hindi kasi mabibigyan ng hindi kasi napapakain ng thank you lang or yung mga pangangailangan natin kasi may mga bills din naman tayo.
Ayon sa DOLE, nasa 33,000 pesos ang paunang sahod ng mga nurse sa mga government hospital. Napakaliit kumpara sa mga paunang sahod ng mga nurse sa ibang bansa na nag-uumpisa sa 100,000 pesos pataas. Pero kung maliit na ang paunang sahod ng mga nurse sa mga ospital ng gobyerno, paano pa kaya ang mga nurses at healthcare workers sa mga pribadong ospital gaya ni Mark? Ayon sa tala ng DOLE, nasa 14,000 to 15,000 pesos ang paunang sahod ng mga nurses sa mga pribadong ospital.
Reuters reported that in 2019, 12,083 new nurses graduated in the Philippines. According to the data from the Commission on Higher Education and the Philippine Overseas Employment Administration, 16,711 signed contracts to go abroad. In the year 2020 alone, there has been 46,000 such renewals of contracts to work abroad. So guys, lahat sila talaga, almost most of our nurses and our workers really go to abroad para lang meron silang mapangbuhay sa pamilya nila. This brain drain, as coined by our health administrators, has been a phenomenon for decades, with the government enacting return service agreements in state universities to temper the exportation of our health professionals to foreign shores. The Philippine Labor Department acknowledges that the overseas pay scale is way above local rate and cites that average salary in the countries where most of the nurses choose to go to. For example, in the US, nurses can make an average of $3,800 per month, guys. Dollars. Imagine how much that is in peso a month. And it doesn't end there. According to the World Health Organization, healthcare workers may become targets of violence during disaster and conflict situations. As many as 38% of healthcare workers are likely to experience violence at one point in their professional life, with nurses and those involved in direct patient care mostly at risk. You may be familiar with the Doctor to the Barrios, a department program forming a group of fresh medical graduates to serve as rural physicians and health officers of doctorless municipalities all over the country because of their reformist impulses or simply because they happen to be in conflict-riddled places. The Inquirer reported that there are very real threats to their own life. In fact, the red tagging of a government doctor in Gilhungan City, Negros Oriental, has affected 33 villages in need of government healthcare. Truly, we need to show compassion, guys. We need to show compassion to our compassionate workforce. Maybe not by clapping outside our doors or nagpapalipad tayo ng mga drones to express our appreciation. Maybe what they need or maybe more of supporting calls to alleviate their situation. Have we mentioned that these are all data from before the pandemic? O guys, before the pandemic pa lang yun. Paano pa kaya ngayong pandemic? So now, join us in this next section as we talk about what the pandemic revealed about our health system.
In January 2020, the word is out. There is a mysterious SARS-like disease spreading from Wuhan around China to neighboring countries South Korea and Japan. Philippine Health Secretary Francisco Duque III orders the Bureau of Quarantine to strengthen surveillance of incoming travelers from China. Among the first being monitored,
it is currently investigating the case of a 5-year-old who traveled from Wuhan.
But authorities stopped short of banning incoming flights from China. On January 29, Duque is summoned to the House of Representatives. He says it would be very tricky if the Philippines singles out China for a travel ban.
If we do this, then the concerned country, and China in this case, might question why we're not doing the same for all the other countries that have reported confirmed cases of the novel coronavirus.
Citizens react and question why Duque is more concerned about diplomacy and why President Rodrigo Duterte is still focused on the drug war. On this day too, a man under investigation in the Philippines for the 2019 NCOV dies due to pneumonia. And the day after, they break the news. The novel coronavirus reaches Philippine shores.
I assure that the public that the DOH is on top of this evolving situation.
Now, as we all know, 31st of December 2019 is when things change for everybody or basically the whole world. This we know for sure. COVID-19 is real. It is very much true. And this we do not need to explain to anyone. Hesitancy about the virus or the vaccine is nothing but a niche idea. In a survey conducted in 2020 in the Philippines regarding preventing the spread of the coronavirus or COVID-19, 79% of respondents stated that they always wore a face mask when going outside of the house. In comparison, only 1% of respondents stated that they rarely or never wore a face mask when leaving the house in the Philippines in 2020. We have vaccinated over half of our population here in our country. We must then turn away from putting the blame on the people who only follow our minimum health protocols. So, what did the COVID-19 pandemic reveal about our healthcare system?
Foreign nationals and returning Filipinos who are non-overseas Filipino workers has been suspended for 1 month from March 20th until April 19th. The decision was made following a directive from the Philippine National Task Force against COVID-19 on
May this year, the Tourism Department has been proposing a green lane where foreign travelers can enter the country without quarantine if they are coming from the green list of countries and are fully vaccinated.
Variant, itong Omicron variant na umakalat po sa abroad at ito'y nakakapangamba dahil mas delikado daw po ito kaysa dun sa mga naunang variant. Paano po tayo naghahanda rito, General?
Well, tama, Julius Zen, no? Matapos na nagkaroon ng balita tungkol sa emergence ng panibagong variant na ito, agara naman pong nag-activate ng ating National Task Force at saka IATF at ng rekomendasyon ng ating mga health experts ay magkaroon ng stringent border controls, yung pagbabantay sa ating mga paliparan at saka sa ating mga seaports. So kaya nga po, immediately after the detection of this variant at na-announce na sa publiko worldwide, nagkaroon po ng resolusyon ng ating IATF na pagpapalawig ng border control na ito. Kaya simula po nung Biyernes ng gabi, pinagbawal na po ang mga flights ng mga pinanggagalingan ng makabagong variant na ito at kinokontrol po natin ang entry from those other areas na maaring may potential.
Our semi-permeable border problem during the pandemic is actually quite alarming, to say the least, for our country's management of the health crisis. We are then witnesses to one of the Philippine government's first balancing acts, one which will be the core of many balancing acts, which is to balance, guys, which is to balance the nation's health and economy. As an economy whose individual spending power is reliant on foreign remittances, the Philippines thus has this conundrum on their table. Okay, so now let us take a look at our economy. So guys, ganito yun. A key event in our lockdown is the closing down of many businesses, right? Leading to a widespread loss of jobs. The nationwide data from the Bureau of Local Employment of the Department of Labor and Employment show that from January to July 30, 2021, in only 7 months, 250,000 and 714 workers had lost their jobs in at least 8,070 establishments. Ang dami, guys. Sobrang dami. And hindi lang yun. At least 6,855 of the businesses reduced their workforce, while 1,215 of the businesses were shut down permanently. Now, with the longest lockdown ever, and these multiple lockdown categories, this is but another indication our government has put themselves in an impossible situation where workers are now made dispensable, diba? The Bureau of Local Employment Job Displacement Report said that in Metro Manila alone, 4,340 establishments were severely hit by the lockdowns, displacing a total of 150,987 workers. Diba?
Lang ang dahilan, mga checkpoints sa magkabilang lane.
Wala pa ngang ganong kita, tapos chipin-chipin pa, ano bang kikitain namin? Ano ba papakain ng pamilya namin?
Dapat po wala na eh, sobrang traffic.
Hirit pa ng ilan, minsan parang nawawalan lang daw ng saysay.
Parang wala rin naman boss kasi ganun pa rin naman nangyayari. Lalo lang umaba yung traffic namin. Tapos kapag dating namin sa checkpoint, wala lang, dire-dire.
Kusang sumurrender bitbit naman ngayon ang kanyang anak.
Ayaw kami bigyan sa barangay, wala daw online, di ba kami marunong mag-online? Sasakay na naman kami to, ay kami pasakay, ano gagawin namin? Mabuti, nagpahuli na lang kami, dinabaksin kami kahapon.
Ano pong kagindahan na nahuli kayo?
Ay, akala ko ikulong ako. Opo. Yung pala dadalhin doon, thank you Lord.
Napagod na ako, Diyos ko.
Naiyak na lang sa sobrang sama ng loob ang empleyadong si Dayan. Di siya pinayagang makasakay ng bus sa EDSA carousel dahil sa no box no ride policy na sinimulan ngayong araw.
Nakakapagod yung ginagawa nila. Wala man lang ano. Partially vaccinated naman kami. Bakit hindi payagan? Nagagastosan na ako ng pamasahe.
Maaga pa naman daw siyang umalis para di malate sa nakatakdang medical exam para sa trabaho.
Nagpabaksin naman kami, hindi naman namin kasalanan na yung second dose namin February pa. December ako nagpa-first dose, ang Astra po kasi yung vaccine ko eh.
Hindi rin nakalusot ang grupo ng mga construction workers sa sobrang higpit ng pagbabantay ng I-Act at HPG.
Yung vaccine ninyo, kailangan second dose. No? Doon kayo masasabi na fully vaccinated. Warning muna to sa inyo, no? Balik na muna kayo sa kung saan kayo galing.
The lockdown brought the military into the streets. The lockdown situation and the healthcare problems are now then pinned on the innocent Filipinos. They aim guns supposedly at virus that is not there, subsequently pointing it to Filipinos who bear the brunt of the government's economic and public health shortcomings.
Tracers were terminated because of lack of funds. Right now, the country has 86,000 contact tracers, including volunteers, and because of the surge, the system gets overwhelmed. Ideally, each one should only be handling 3 to 4 cases. But because of the surge, they are handling more than 30 cases, each one every day. Contact tracing czar Benjamin Magalong said he is surprised by this development because contact tracing should be a critical aspect in pandemic response.
Sana wag na pati-undermine yung contact tracing because critical pa rin yan doon sa ating strategy. Contact tracing dictates yung testing rate. The more you contact trace, the more tests you conduct, the higher test that you conduct, you'll be able to seek out yung mga positive.
Magalong admit,
the COVID-19 pandemic only but revealed the government's brittle infrastructure base. Attempts were made to be able to test the populace as needed. Contact tracing systems were attempted to be constructed to slow the spread of the virus. As of this date, there is no single centralized contact tracing infrastructure in the Philippines, rendering any virus mitigation method cosmetic and useless. Baguio Mayor Benjamin Magalong, who is also the contact tracing czar, noted that based on data, the Philippines is only able to identify at least 7 contacts per coronavirus infected person when the ideal contact tracing ratio should be 1:37 for urban areas and 1:30 for rural communities. Okay, so now we'd favor or mas gusto naman talaga natin siguro to have a much lighter tone in our podcast, di ba? But such glaring blunders are not something that we can just sweep under the rug. Ika nga, di ba? We cannot put lipstick on a pig. The Philippines fell to the last place in Bloomberg's COVID resilience ranking of the best and worst places to be in amid the pandemic, with a steady decline over the course of 2021.
Officials of the Philippine Health Insurance Corporation, or PhilHealth, have allegedly pocketed around 15 billion pesos from the agency. That's the claim of whistleblower attorney Thorson Keith at the start of the Senate probe on alleged corruption in PhilHealth. Board member Alejandro Cabading backed Keith's claims over an IT budget proposal supported by PhilHealth chief Ricardo Morales that allegedly contained questionable and overpriced items.
The government propelled the earnings of controversial supplier Pharmaly Pharmaceutical Corporation from a capital outlay of 625,000 pesos in 2019 to a net income of 264.7 million pesos in 2020. Financial statements and notices obtained by Rappler show the company is poised to earn at least 2 billion more in additional pandemic contracts. Pharmaly's financial statement for 2020 shows its sales that year was a whopping 7.49 billion pesos. In 2020, the government awarded Pharmaly at least 7.9 billion pesos in pandemic contracts. Contracts accessed by Rappler from public databases show they have won at least 4 more pandemic contracts worth 2.3 billion pesos in 2021. One of the contracts worth 37.9 million pesos for 2 million face shields was awarded by the DOH on June 11, 2021. Pharmaly Pharma won that contract through a venture with a young company called Business Beyond Limits, OPC. The rest of the contracts Pharmaly Pharma won in 2021 are 507.3 million pesos for 517,613 personal protective equipment sets awarded by the Procurement Service of the Budget Department on May 19, 2021. 774.3 million pesos for 17,000 RT-PCR test kits awarded by PSDBM on June 2, 2021, and 1 billion pesos for 26,970 RT-PCR test kits awarded by PSDBM on July 26, 2021. Rappler's investigation shows Pharmaly Pharmaceutical Corporation is linked to President Rodrigo Duterte's former economic advisor, Michael Yang, through one of its owners, Singaporean Huang Zuyen.
The public trust we put into our public officials bears an uncountable mass of gravity. We put our trust into these administrators to lead us out of the pandemic safely, not to mitigate the irreplaceable lives whose deaths they seem or deem unavoidable. Folks, our pandemic response effort is in dubious hands. As we find ourselves powering through this spike in COVID cases, we need to ask now, right now, as you are listening, what now of our healthcare system?
Ng Philippine General Hospital, pero may ilang pasyente pa sa COVID ward na nakaabang kung may mababakanteng kama sa ICU. Ang mga pasyenteng malala ang COVID nakakabit na sa mga aparatong tumutulong sa kanilang paghinga. Yan ang realidad na kinakaharap ngayon ni Dr. Jubert Benedicto, espesyalistang naka-assign sa COVID ICU ng PGH.
Pinapaliwanag ko, kayo po ilalagyan ng respirator, bibigyan po kayo ng anesthesia para po makatulog ng konti. Paggising nyo, nakakabit na po kayo sa respirator. Ngayon po pa lang po ba, may gusto po ba kayong tawagan para po makausap ninyo na kayo ay kinakausap na wala pa hong tubo? Doon na nanggagaling, Sandra. So papatawag yan ng anak niya, ng asawa niya. Tapos in front of you, doon na yung mga habilin. So doon na yung mga sasabihin nilang basta mag-ingat kayo, mahalin nyo si mama nyo. Talagang nakakatusok sa puso mo.
Maraming healthcare workers na raw ang pagod at habang hindi pa kumpleto sa bakuna, nariyan pa rin ang pangambang pwede ring mangyari ito sa kanila.
Aminado talaga kaming pagod. Wala sigurong magsasabi sa inyong hindi kami pagod. Kada suot mo ng PPE, kada hakbang mo na nasa loob ka ng ospital, talagang nagpi-play sa isip mo na wag naman sana, pero po pwede rin mangyari sa itong nakikita mo lahat. Yung nakikita mong okay sila kahapon or 2 days ago, tapos ngayon nagkikita na kayo sa emergency room dahil hirap na huminga.
Private hospitals threaten to hold a strike. They are dismayed by government's unfulfilled promises of benefits for health workers. One union warns of the possibility of mass resignations.
Pakiusap po, panahon na bigyan niyo ho kami. Wala pa ho tayo sa dulo ng laban. Palala ng palala ang sitwasyon. Kilalanin niyo po yung mga totoong nagbibigay ng sakripisyo.
Pwedeng lalabas kami at kahit pa sabihin natin na ulihin kami dyan ng mga pulis. Pero igiit namin yung karapatan namin, magrarally kami sa labas para lang marinig ng mga kinaukulan yung aming hinaing o lalo na sa mga nurses. Isa naman na kung wala na tayo, no choice na mag-resign na sila, sino pang mag-aalaga?
Filipinos then went to social media to voice their disdain against the pandemic response. We frequently found netizens now feeling they have no one but themselves to survive this pandemic. Outraged, the people took to different channels to try and alleviate their situation. Because without reliable leadership, the people have now turned to themselves by way of different relief efforts in food security and medical supplies to indigent communities. Again, the Filipino are resilient. That is true. But that is not an adjective for our government to abuse. It is now of grave and mortal importance that we select a leader that will, with our whole chest, save the Philippines from this pandemic and pandemic response. Guys, this is our wake-up call. As you make your big choice in May, now you vote calls to everyone to please select a leader that will scientifically lead the country towards eradicating the risk of COVID-19 as a public health concern. Prioritize the infrastructure of healthcare system and the well-being of healthcare professionals. Invest on research to build up the country's local disease response infrastructure. Champion a healthcare system inclusive of all Filipinos across the regions, and of course, exemplify accountability and transparency in pandemic response. Kabataan, in light of these circumstances, it is clear that the upcoming elections is a very decisive elections for our health system. What should we not only look out for, but also advocate for our future leaders in the upcoming elections? Keep asking those questions to yourself. Keep looking out for one another. It is, with no exaggeration, the only way we can keep ourselves alive. Ganun kabigat yung hawak natin, guys. And that has been it for our crash course on Philippine health system. Ngayong 2022, ang panawagan ng Now You Vote ay kabataan ang maririnig, katotohanan ang mananaig. It is time to exchange your views and knowledge with your peers. Engage your communities and candidates for a meaningful change beyond the ballot, and commit to your right to suffrage as your vote defines the Philippines of our generation and maybe even the next, right? Bukas na bukas ang aming online tanggapan for youth activation sessions and resources to help you make your big decisions and to nurture your important conversations. Email us at secretariat.nyv@gmail.com. And now you can also join our Discord server. Makiugnay, makipagtalakay at bumoto kasama ng inyong kapwa kabataan sa discord.gg/nowyouvotehub. Again, this has been Migo, reminding you guys to participate in 2022's most important conversation and to make your 2022's biggest decision on May 9, 2022. See you guys on the next episode.
Kabataan ang maririnig, katotohanan ang mananaig. Oras na, tayo na, boto mo'y mahalaga. Kung hindi ngayon, tikilos, kailan pa ba?